Go ahead, Mr. Mayor, please.
Okay, thank you. And good afternoon, everyone. Thank you for joining us this afternoon. I'd like to welcome Michelle Baird, who's representing our public health team today. And of course, Paul Johnson, our city's Emergency Operations Center Director. A reminder for our media that the Hamilton sign will be turned off today, and flags at City Hall and city facilities have been lowered to half-mast in remembrance of the 215 Indigenous school children whose bodies were found at a residential school in Kamloops. That'll be all city facilities for 9 days or 215 hours. Locally, we remain under a province-wide state of emergency and stay-at-home order until at least June the 2nd. Hamilton's vaccination effort continues forward at a significant pace with 322,445 doses administered. I know Michelle will have some additional information on that a little later on. Vaccinating community members, especially those most at risk, remains a critical tool and top priority in stopping the spread of the virus and moving into step one of the provincial reopening plan. So the province's three-step roadmap to safely reopen with a tentative start date of June the 14th for step one. It is important to remember for everyone to understand that June 14th date is tentative and is dependent upon provincial vaccination rates, declining hospitalizations and intensive care unit stats, as well as case and percent positivity rates as well. So we're not there yet, but certainly heading in the right direction. We need to continue to follow all the public health measures still that are in place, even if you've been vaccinated, to help spread the virus and do your part to help move us to step one of the provincial plan. So thank you to everyone for doing your part by following our public health measures. You are making a difference. Please visit hamilton.ca/coronavirus for a fulsome list of restrictions under the stay-at-home order and everything else that you might want to know about our stay-at-home or the recommendations or dollars and cents that are available as well through the CERB and other matters are all on the Hamilton coronavirus website. I'm now going to pass it over to our Emergency Operations Center Director, Paul Johnson. Paul.
Thanks very much, Mr. Mayor. And, as we do wait for what will happen on Wednesday and looking forward to the steps, there's not a lot of new information today. I would just say to the public that I know there's a lot of questions about what will we be able to do? What are the limits? What are the sizes of gatherings? Is it going to happen faster? Is it going to happen slower? And I'd love to have all of those answers for people. We don't have those yet. We're waiting on the province to both set those limits as we move closer to the summer, as well as the sense of exact timing on when things will happen. I will say that, lifting of the stay-at-home order, should that happen on Thursday at 12:01 a.m. or Wednesday would be the final day, it does not necessarily mean we're moving into step one, does not necessarily mean a whole bunch of things are going to reopen. We're waiting to see what that period of time may look like between when the stay-at-home order may run out and that entry into step one. So it'll be very important for people to follow media around this. Look at our own website in order, let's not guess in terms of what's happening, because while we continue to move through these various stages, we continue to, of course, encourage and when necessary, enforce the existing rules and regulations. And we have been doing more enforcement, and some of that enforcement has been at private residences. And as you'll see on our website, a business that has had charges before under these provincial orders is back on our list again. And this had to do with a gathering that was being held in the basement of the establishment. A little more than 10 people there, and some loud music was heard on the street level. So that's what I think alerted some folks to it. But as you can see, some charges were laid in that case. It is really important that as we are able to gather with a few people outdoors, that we recognize that is where that ability ends. This is not a time for indoor gatherings, whether you're a business or whether you're a private individual. That's not to occur, nor are large gatherings to occur. This is a way that we can get together with a few people. It's welcomed, it's important. If it happens outside, it can be done very safely, as long as you follow the public health guidelines of keeping distance, wearing a mask if you can't, and obviously practicing very good hand hygiene. And obviously, if you're sick, not well, don't be attending work, don't be going places, even outdoors. Get that test to make sure that it's not COVID-19. And then it's allergy season, so a lot of people will say, oh, it's just allergies. And the answer to that is, yeah, it may very well be. But if it's a new and the symptoms just seem to be a little bit in line with what could also be COVID-19, please get that test. It's a very simple way to rule it out. The turnaround time on the test is very fast these days, so you'll know quickly. And that way you can attend some of these things safely. We're still concerned about the spread of this virus, still concerned about the variants of concern that exist within our community and becoming more and more prevalent in terms of what's happening with this virus. So we need to do our part. So again, stay tuned. We'll be able to communicate what the changes are as we move through the month of June. It'll be on the website. The province will have lots of information. And the less guessing people do, or maybe hearing something as a rumbling and starting to do it, make sure you check a credible source, and the City of Hamilton will have all that information available for you as soon as we find out. And we're eagerly awaiting some of those pieces so that we can start to move towards a more open summer with more activities here at the city, and also more activities are happening in the across the community in other ways. So over to you, Michelle.
Thanks, Paul. Good afternoon, everyone. With respect to current confirmed COVID-19 cases and trends, we have 20,545 cases total in Hamilton reported today, which is a change of 53 cases from yesterday. These include 1,869 local screening positive variant cases, 4,872 B117 variant cases, that's the United Kingdom strain. We have 50 confirmed P1 variant cases, that's the Brazil strain, and 25 confirmed B1351 variant cases, the South Africa strain, and 1 confirmed B1617 cases, which is the India strain. We have 3 cases associated with lineage B16172 and 1 case associated with lineage B16171. There's also 2 cases posted as COVID-19 other variants. These are cases that are not yet classified as variants of concern on the website. Locally, then, Hamilton is sitting at just over 73.8% of cases with a mutation or variant of concern when looking at cases reported over the past 7 days. Of the 20,545 cases, 93.3% are now resolved, meaning we have 544 active cases in Hamilton. Unfortunately, there have been 388 deaths to date, and today we are reporting 2 new deaths. We are reporting a total of 26 local outbreaks on our website, but we have no new outbreaks to report today. And Hamilton's 7-day moving average reported per day is 61, and our weekly incidence per 100,000 is 72, with our weekly reproductive rate at 0.68. So with all that, COVID numbers are continuing to move in the right direction locally, which is really encouraging for all of us. However, I want to emphasize how critical it is that we stay vigilant as a community and continue to follow public health measures, even when vaccinated, to keep our loved ones safe and to push our COVID-19 case numbers lower and lower. We all have a role to play in reopening Hamilton safely, so let's continue to keep our guards up and book an appointment for a vaccine for those who have yet to take that crucial step in our reopening journey. And speaking about vaccine, as of today, locally, we administered 322,445 vaccines in Hamilton, making that an estimated 62.5% of all Hamiltonians over the age of 18 and 9.6% of youth 12 years of age and older receiving a vaccine to date, which is great news for all of us. We continue to see a stable and reliable vaccine supply and a number of available appointments available locally, which is also encouraging news. Starting this morning, community members 80 years of age and older are eligible to book an earlier appointment for a second COVID-19 vaccine dose. It's important to note that Hamiltonians can book their second dose vaccine appointment at many locations in the community, whether that be a large-scale clinic, a mobile pop-up clinic, at a local pharmacy, or even a primary care setting. Your second dose does not have to be at the same location as the appointment where you received your first dose of vaccine. If you're rescheduling a second dose vaccination appointment, community members are encouraged to check their first dose vaccination receipt to ensure they are booking a second dose for the same vaccine type. For example, if you received a Moderna vaccine for your first dose, please book a Moderna vaccine for the second dose. It's important to know that mixing vaccine types is not permitted. When it comes to youth aged 12 to 17, only the Pfizer vaccine is approved by Health Canada at this time. Our vaccine strategy for young people is comprehensive to ensure that all young people aged 12 to 17 who want a vaccine are able to do so in a location that is most appropriate for them. Young people in that 12 to 17 age group have a number of locations where they can receive a first dose of Pfizer vaccine, including our large-scale clinics, select pharmacy locations in Hamilton, and at our family-friendly clinics. Special family-friendly clinics will be running the week of June 14th and the week of June 21st at the Hamilton Health Sciences Wellington Street Vaccine Clinic. These appointments are available to book on the provincial portal as of now. These family-friendly clinics will include a separate area for youth and family, so people are there together. There'll also be additional supports for those youth with special needs and those experiencing perhaps anxieties or whatnot. And these clinics will be supported by child life specialists. More information on these youth-focused clinics will be coming in the coming days. Information for community members on local vaccine clinic locations, both large-scale, primary care, and our pop-up clinics are listed on the city's website at www.hamilton.ca/vaccine booking. We encourage all community members to book through the province's booking tool, which can also be found at www.hamilton.ca/vaccine booking or by calling the provincial call center at 188-999-6488. And that's really my update for today.
Okay, thank you, Paul and Michelle. And, so far the good news is we're heading in the right direction, and I think that's very positive. So thank you everyone out there that continues to do the right thing by, again, staying at home as much as possible or within your own household. Certainly lots of things are open right now, whether it's tennis or basketball or splash pads or trails, golf courses, stairs, which has been a thing, and certainly people I'm sure are anxious to get back to get that exercise in our stairs. So they're all open, and I'm sure that's lifting everyone's spirits, but it is still very much important to continue to use them safely and to continue to physically separate and stay within your own households as much as possible, because those viruses are still out there, haven't disappeared, but we're certainly in a better place than we were weeks ago. So hopefully we can have that continue. It's vital to continue that then, and certainly get information through our COVID-19 website. We'll give you all the continuing information in terms of how to get vaccinated, and certainly we encourage everyone that's able to get vaccinated as soon as you can. It is the best way that you can serve your family, your friends, yourselves, and your community by getting vaccinated and hopefully getting us to a place where we can get back to more things opening up on a more sustainable basis as we go forward. So we're all anticipating that happening sometime soon. Don't know the details yet, but certainly if we keep heading in this right direction, that will come sooner rather than later. So thank you for all that great work. I'm going to turn it over now to Jasmine for questions from the media that I'm sure I'll hear and anxious to ask a few questions of our staff. Thank you, Jasmine.
Great. Thank you, Mr. Mayor. We have 5 media joining us today. We'll start as usual with 1 question and 1 follow-up for everyone. First question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi. Oh, thanks very much. I hope you can hear me okay. Just saying that we're expecting to hear from the province about schools reopening sometime in the next 2 days. I'm just wondering, I guess this would be for Michelle Baird. Can you comment on transmission of the virus in schools up until now? And do you think that we're likely to see a significant increase in cases locally if in-person learning does resume in Hamilton?
Thanks, Lisa. So locally, we have had cases certainly in that 12 to 17 and younger, the school-aged group for sure. We do recognize, however, the importance of in-person learning and how critical it really is for youth with respect to mental and emotional well-being for our kids, that they do have the opportunity to be in school and have that sense of routine again. Despite the possibility that there could be transmission, of course, in that environment, we've maintained since the beginning of the pandemic that schools should be the first to open and last to close, given the importance of schools in the community. We will continue to monitor the local situation as it relates to COVID-19 in the community. Ultimately, this is a provincial decision to be made. We work continuously collaboratively with our school board partners to ensure that health and safety measures are in place, including daily screening for symptoms, that kind of thing. And we'll continue, of course, case and contact tracing in a timely way within those environments.
Okay, thanks very much. And my second question, I'm not sure if it would be for you or for Paul Johnson, since it's kind of about vaccine eligibility, opening up, and the resources that the city has in place. Just wondering what the process will look like for those who booked their first dose through the public health hotline. Will they have to call the hotline again to get their second appointment moved up? And do you anticipate that, as eligibility opens to new groups, there's going to be, those long wait times for people who are trying to get through? Is that going to be basically everything happening all over again?
Thanks, Lisa. I can take that one as well. So with respect to second dose booking, no, we don't anticipate that that's going to be the case at all. The provincial booking tool, be it the online portal or the phone number, will allow second dose both booking or appointment changes independent of the first dose. So no matter where people got their first dose, they'll be able to make arrangements through that portal or through the phone line for their second dose. And that includes folks that got it at a mobile clinic or other. And that will include too the ability for you to move your location, where if you received a first dose perhaps at a mobile clinic and you choose at this point to go to a pharmacy, those options will be made available to people. So we don't anticipate the phone line booking challenges that we had earlier on.
Thanks, Michelle. Our next question would be to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. My first question is for Paul. So I've just noticed that a number of Hamiltonians have been hosting yard sales in the recent days and weekends, but there's no provincial guidance on yard sales. And I know that we touched on this last spring or summer, and I'm hoping you might be able to shed some light on the city's stance around yard sales right now, and maybe how people should go about hosting them in a safe manner if they do choose to go ahead with them.
Sure. So yard sales would fall under, in our case, on the private property. So there can be no yard sales that occupy public space. So moving into a park using a city parking lot or something like that is prohibited in all its ways. But if people do have it on their private property, they are responsible to keep within the guidelines provincially, and that would include the number of people who are coming, which is capped at 5, and that they would be responsible for ensuring that those folks keep an appropriate distance away from each other. So that's the way we've looked at this throughout the pandemic, and we know that this is a time of year where these things are going to happen, and so we've put the one parameter is that we can't have community sales where people take over streets or take over public space and bring lots of folks together. But if people do try and have one privately, they need to keep the numbers down, and they need to keep people safely distanced while they're doing their business.
Thank you. And my second question is also for you, Paul. Just going back to that gathering you said in the basement, can you tell us anything more about that gathering? And you said that this business had already broken the rules once before. Can you give us any insight into what's going on with that business? Is there an investigation, or what exactly was going on there? I don't know what else you can tell us.
Yeah, so the size, it was a gathering, obviously a party of some kind. The gathering was, and then a little bit more than 10 people is what the information I've received from our municipal law enforcement folks. So not hundreds of people, but still beyond. And of course, there can be no indoor gatherings at all. So it's not a case of being won over or something like that. It can't happen. There is an investigation that will be going on, and I can assure the public that, again, this is a business that has had charges in the past, and we're reviewing this and reviewing the business license as well. But that's as far as I can go in terms of talking about the specifics of the investigation. But I can confirm that we're looking further into it to see whether other actions should be taken in this case.
Great, thank you, Paul. Our next question is to Manisa from CHCH. Manisa, you can go ahead. And Manisa, if you're there, we can't hear you.
Sorry, can you hear me now?
Yes, we can. Go ahead.
Oh, sorry about that. Thank you for taking my question. My question is actually for Michelle Baird. How many patients were brought to Hamilton's mobile health unit, which started taking patients today? About that information, sorry.
Hi, Manisa. Sorry, I don't have that information available with me right now with respect to the mobile. I think you're speaking about the mobile health center at Hamilton Health Sciences.
Yeah, sorry.
Yeah, sorry, I don't have that information available.
Okay. How many vaccines have been booked so far for children 12 and up? I'm not sure if you mentioned that earlier. Sorry about that if I missed it.
Thanks, Manisa. No problem at all. So as of now, I can't tell you how many are booked because, of course, they're open for booking at this point in time. But right now, we do have that youth 12 years of age and older, 9.6% have received a vaccine. So that's the 12 to 17-year-old age group.
Okay, thank you. And is there anything else that you can tell me a little bit more about the family-friendly vaccination clinics? Is it just the one at Wellington Street right now?
Thanks, Manisa. Yes, so at this point in time, the family-friendly vaccine clinics will be held at the Wellington Street location at Hamilton Health Sciences. It's actually 2 weeks worth of vaccine, so the clinics will run daily over those 2 weeks, that 2-week time period. Those are the family-friendly specific clinics from June 14th to 21st. But of course, anyone 12 to 17 can go to any of our other clinic sites or pharmacies that offer the Pfizer product. So those aren't the only times when people can receive a vaccine. Those clinics are just going to be set up in such a way to support those individuals or families who might need a little bit more support getting through the clinic experience.
Great, thank you, Michelle. Next question will be to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Great, thanks so much for taking my question. This first one is for Paul Johnson. And you mentioned it being important for people to know the rules as they start to change so they don't mistakenly break them. And I'm wondering if the city has seen things that have been going on that sort of walk that line of what's allowed and what isn't, and if that's been a problem.
I think what we're seeing is that people are stretching the envelope just a little bit in terms of the gathering sizes. And, you know, in terms of being outdoors, we understand that. And I think really where we're trying to take a much harder line, and there really is no wiggle room, is on indoor gatherings. You know, we're shifting into a time period where it's really important that we understand the potential risk levels. And the longer you spend indoors with people that you don't know and don't live with, not that you don't know, that you don't live with, that aren't part of your household, and perhaps do that without all of the proper protections in place, that's where risk is highest. And that's right now what we're trying to discourage so that we can keep that spread down. If you think about the outbreaks that we still have happening in this community, they're being driven by that indoor, closer contact, those types of things. So if we can cut that back, and that's why we take a really, you know, tougher line on the indoor gatherings. The outdoor stuff, do we see groups that are probably more than the 5 and probably not households of people that are in the same household? Sure, but as long as the attempt is there to make it acceptable, that's fine. Now, when it comes to a private backyard gathering, we're going to ask that you keep it to that number. Let's have those 5 people gathering. Those will start to change as we work through the steps, and this is where we just ask for a little more of that working together as we move through the steps, which once we start getting into it is only about 7 weeks. You think about step 1 coming at the middle of June, step 2 is likely, if everything goes well, to be the beginning of July, and then step 3 at the end of July. So it's not as though we're talking about 3 months or 6 months of this work. It really, once we get into it, it will be about 6 or 7 weeks is the hope. And if that can occur, then we're going to see heading into August and September that things will be much less restrictive. So right now, what we are seeing is still people having those indoor gatherings. And whether it's private residences or the occasional business hosting some people inside, those are the ones that we're greatly concerned about. Because if you look at household transmission, if you look at workplace transition, if you look at the other types of outbreaks we're having, they're happening indoors. We're not seeing outbreaks connected to people getting outside and walking on a trail or biking together along a roadway. So that's where we're going to continue to put our attention while we continue to work on the vaccine protocols and the vaccine work that's happening in this community, and get ourselves to a much better place where we can be a bit less restrictive indoors as well as outdoors.
Thank you. And then my next question is for Michelle Baird. And earlier this May, the David Braley Center was offering shots of AstraZeneca. And I'm just hoping you can clarify what the plan is for second doses of people who got their shot there.
Thanks, Christine. Well, that's a very good question, and it's one that I don't fully have the answer for you. We know that Health Canada did announce that they extended the expiration for those AstraZeneca doses that were extended to until July 1st rather than June 1st. We know that they're approved for that longer expiry date, but we're waiting for direction from the provincial government with respect to how that rolls out and what it means for our supply locally. I will say on the David Braley side of things, however, we are quite pleased that we had over 1,300 second doses administered over the past weekend through our primary care partners at the West End Urgent Care Centre. So we did have quite a high uptake of second doses of AstraZeneca, and hopefully we'll hear from the province with respect to what it means for the remainder of our supply.
Thanks, Michelle. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is for Michelle. Michelle, Hamilton seems to continue to see very high percent positivity. Can you talk about, why that number seems to be staying pretty stubbornly high while other metrics are falling?
Hi, Joanna. Thanks for that question. It's a challenging one to answer, and it's certainly a good question for sure. Percent positivity, of course, really depends on the numbers of people that are getting tested and who it is that gets tested. I can't say for sure what's driving our number, but I will say it's very possible that the right people are being tested. So people that are symptomatic are going in for testing versus, the more worried well or asymptomatic individuals, because it certainly points to the fact that people that have COVID are the ones that are getting tested for COVID. On the other hand, we are going in the right direction with respect to our case numbers overall. So it's great to see that people are still continuing to be tested if they're symptomatic. But beyond that, I really don't know what's driving our specific number versus other locations.
Thanks so much. And my next question is also for you, Michelle. We're hearing from a lot of seniors who are very confused about how to get these second doses. We're particularly hearing about problems with booking into pharmacies and people with AstraZeneca wanting to know if they can get a different vaccine than AstraZeneca. Can you talk a little bit about, provide some help and clarity for these people who are having difficulty with their second doses?
Thanks, Joanna. Yeah, so as of today, again, those 80 years and older are eligible to book an earlier appointment if they choose to do so. It's important to note as well that if they choose to stay with the appointment they have, those appointments are being honored, of course. So if people want to come to their original second dose appointment, that's their choice to do so. With respect to moving that second dose appointment, they can move them to different locations. Really, the key is to use the provincial tool or phone number available. If they want to move it to a local pharmacy, again, it's important that they move it to a location that's offering the vaccine that they had for their first dose. So for example, if they had Moderna as their first dose. Right now in Hamilton and really provincially, there is a limited supply of Moderna available, so they would need to wait to get one of those locations. But overall, I would say that they can use the provincial system. We recommend they use the provincial phone number. If they don't have a health card, they can certainly call the hotline. But at this point in time, their second doses, if they are eligible for an earlier second dose, it is through the provincial booking system.
Thanks, Michelle. So we do have a bit more time, so we'll go through once more for one more question each. We'll start back with Lisa Pileski from CHML. Lisa, if you'd like another question, you can go ahead.
Thanks very much for the additional question. I'm not sure if you're able to give me an answer, Michelle. Just wondering about those 2 variant cases that have been classified as other. Is that something that people should be worried about, like a new mutation, or is it just that those particular cases can't be put into an existing category for whatever reason?
Hi, Lisa. Thanks. Yeah, so at this point in time, what it means for those cases, it could be that they can't be categorized, or it could be that we're just awaiting further categorization. There's nothing specific about those 2 cases at this point in time that we're particularly worried about. They could simply be waiting classification.
Thanks, Michelle. We'll go next to Fallon Hewitt. Fallon, if you'd like another question, you can go ahead.
Thanks. This is a question for Paul. You said that there was a lot of, you mentioned very briefly that there was some enforcement at private households. What kind of, was there been an uptick of gatherings at private homes? Like what kind of enforcement are you seeing? Are there like lots of parties, or what's sort of happening indoors, I guess, from a bylaw perspective?
So they're what I call, family or private gatherings. So we've seen an array, and I'm talking over the last number of weeks. So this isn't, in the past week, we had 12 charges that were laid at residential properties, and then we had the 6 that were at the Allure Lounge, which are on the website. So an additional 12. These are birthday parties, private gatherings, those types of things that are going on. We've had baby showers in the past. We've had engagement parties that have happened in the past. So it's those types of events. I would call them, the rites of that we go through, the family gatherings and the celebrations, anniversaries and birthdays and those types of things. And they are all driven by complaints. We don't proactively go to private residences and knock on doors and see what's happening. These come in by complaints by the community. And so, neighbors see lots of cars attending and lots of people going into a residence. They alert us, and we will attend and see what's happening. But it's, it just is those things that we all want to get back to. And the piece that I'd add in terms of our position on this is that we're going to get there. Just give it a little more time and we'll make it happen. But the reason why we continue to enforce in this way, and we will attend to private residences and we will take these indoor gatherings very seriously, is that when you look at what drives transmission, it is oftentimes, you've heard Dr. Richardson, you've heard Michelle talk about this, that it is that transmission within households. It is that transmission within these gathering areas, and homes are not large. And the people you get in a room, it will be it's a decent number of people in a very small area. That is where the transmission is still occurring. It's where it can occur. And we want to get these numbers down as low as they possibly can and get those vaccination rates up and the full vaccination rate up as high as we can. So it's a little bit of that timing piece. And I know people feel that we're being too hard or this is that. But when it comes to those indoor gatherings, there is a huge reason why. And that is because the transmission becomes much more risky when you're talking about prolonged connection with people in an indoor environment. Completely the opposite of playing, 3 hours of tennis on a Sunday afternoon. Those are the types of things that are very safe to do. And we have little concern about that, but we do concern ourselves with some of those indoor gatherings for sure.
Thank you, Paul. We'll go next to Manisa from CHCH. Manisa, if you'd like another question, you can go ahead. And Manisa, if you're there, we can't hear you. Okay, we will go back next to Christine Rankin. Christine, if you'd like another question, you can go ahead.
Sure. Thanks for the extra question here. And I'm not sure who might be able to answer this, but I know the city was talking about about workers having less than positive interactions with people trying to book vaccine appointments. And so I'm just wondering whether this was kind of alleviated as the province opened eligibility, and perhaps if there's any concerns it could occur again with this ability to reschedule.
Hi, Christine. I can answer that question for you. Yes, so that occurred at a time when I think there was a significant demand for vaccine. Lots of people were anxious, of course, to receive their vaccine, and I think that frustration is certainly running high. At this point in time, fortunately, we're not seeing that occur anymore. I think that people are able to get their vaccine appointments and get their needs met. And so we would thank people and, continue to be patient. At times, the phone line, of course, is busy. At times, there may not be the appointments available that you're hoping on the provincial tool, but we continue, we're grateful to people that they are being patient and respectful when they're on the phone calls with us.
Great, thank you, Michelle. We'll go next to Joanna. Joanna, if you'd like another question, you can go ahead.
Hi, thanks so much for the chance to ask another question. My question is for Michelle. You had said that 1,300 people came to that West End urgent care clinic over the weekend. I just want to make sure I have this right. Last week, Dr. Richardson had said 1,900 people were eligible. Like that seems like a phenomenally high rate of people get their second when there's only 1,900 eligible and 1,300 show up.
Thanks, Joanna. Yeah, we're very pleased, of course, with that turnout because it certainly exceeded our expectations. I would say that we did have 1,900 individuals who were eligible. We can't say for certain that those 1,300 are completely from that group. These individuals could have come from populations elsewhere during that same week, but we are very pleased to say that we had a great turnout locally, and likely a good number of those individuals who are eligible for their second dose received it.
Great, thank you, Michelle. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you, Jasmine, and thanks go out to Bill Custers and the entire team at Cable 14 and Clear Cable, as always, doing a great job of helping us provide these media updates in our community. So thank you all for that great work. And thank you, residents out in the broader community, for doing your part. We are at a better place, but we are still in a stay-at-home order. So please do everything you can to eliminate the spread of this virus as much as possible. The more that we're able to do that, and the more that we're able to vaccinate more people, as that's already happening, the better off we're going to be in the coming weeks and months. So thank you for all that great work. As always, more information is on our COVID-19 website, whether it's financial supports or any other updates. Visit our website at hamilton.ca/coronavirus. And please continue to follow all those public health measures. They work. They do help stop the spread of this virus. In the meantime, we'll be back here on Monday, June the 7th at 3 p.m. So be kind to one another, be patient, and look forward to our next media briefing on June the 7th at 3. Thank you.